Hello, everyone, and welcome back to the Direct Specialty Care Alliance webinars. Today, I have the pleasure to have a very special guest, and I'm not saying it's very special just because it is very special. Lara Kenney is, I can call her my partner in crime here. Lara is a board-certified internal medicine physician that has certifications, and she's multiple. Yeah, right. You are multiple board
I
certified
paid the
in.
boards a lot of money.
Yes, in you are multiple board certified in hematology, oncology, and hospice and palliative care. Lara, welcome.
Thank you. I'm so glad to be here with you.
All
Definitely
right.
my partner in crime. I concur.
So Lara is a graduate of the University of Missouri, Kansas City School of Medicine, and she also completed her additional trainings at the University of Kansas City, but now she is practicing in Clinton, Missouri. Am I correct?
Correct. I live and practice in Clinton, and actually where we live, it's very small. So there's several small towns, and my office is technically in Leeton, but I'm not sure that would even come up on the map if you put it in.
So Lara, because we are trying to encourage and empower other physicians to adopt direct care, I have to ask you, where did you hear first about direct care?
Sure. So I first heard about direct care in the fall of 2018, it would be now, which sounds like a long time ago and also feels like it was yesterday, I swear. So in probably August of 2018 or so, I had a change in careers that I wasn't expecting, where I was employed at the time by a large corporate healthcare entity that many of you are probably familiar with, and was humming along, having a family, not really thinking much beyond the day in front of me in that survival mode that we can all relate to. Figured that I was just going to be doing that for the foreseeable future until I had a little more personal time, at which time I was going to continue that job, but maybe, more days per week or even full time. And I was approached somewhat out of nowhere by the corporation that they had discussed selling the practice to a private for profit practice that was owned by a couple. And they already even had plans, like drafted plans for the clinic and whatnot. And they were like so excited to tell me that I was going to be working for these people now. And I was not so excited to be told that way. I had never thought of myself as like an owned entity. I think most physicians have a sense of autonomy, or we wouldn't have chosen to be a physician. We would have chosen something that was less autonomous, like nursing or physician assistant or whatnot. So despite their smiley faces, I was really taken aback by this. I was bothered that it had been discussed without including me in the discussions. I was bothered that it had been presented to me as a done deal, as if I'd literally kind of been bought and sold from one entity to another. And of course, I just had basic reservations about what was this deal they had brokered that I'd had no input in, and did I even want to work for these new people? That, and how come nobody cared that what I wanted to do? So this led to a series of events, which eventually led to me resigning from that position. And in the course of trying to figure out how I could do that and still remain in this community that we had relocated to, and still maintain my sanity and be able to see my patients, et cetera, I completely blindly stumbled on direct care. I'd never even heard the term. I didn't know anybody doing it. I had no idea it was something people were even doing. In my experience, I started med school in 1997, so late 90s, early 2000s, being in training, all I had witnessed was that private practice essentially no longer existed. So when I started training, it was pretty common. And by the time I finished training, all the private practices had essentially either closed their doors as a retiree or sold to a hospital system. And so it's not something I'd even entertained. Although when I was thinking of being a doctor. I had assumed I would own my own clinic because at that time that was the model, when I was in high school and whatnot. And I come from a family, my dad's a dentist, he owned his own clinic. So I was prepared for that reality, but that world had shifted and I didn't think it was even something people did anymore, to be honest. So to wrap that all up, I have a friend from medical school who was also in the Army, which is something that I did for 7 years, who had just opened a practice. And I saw it on Facebook. It was just, it's this acquaintance that I don't talk to too often, but still keep in touch with. And I saw where she had left an employed position and was announcing proudly that she'd opened her own practice, and she's family practice. And so I cold called her and just said, Andrea, what is this that you're doing and how the heck did you do it? Not knowing that it was direct care, just a lifeline. And that was, I think, November of 2018. It was right around the holidays of 2018. And I sat in the driveway and talked to her for probably close to an hour and just soaked it all in. And, my wheels were turning. I was putting two and two together. She and I had similar professional experience because of our Army time and the same basic clinical training from med school, which was fortunately excellent, the program that we went to. And so by the time I hung up with her, it was a done deal for me. I was like, this is something that's achievable. This is something I already have the skill set to do, because that's what we did in the military. We showed up and set up clinics and anywhere, everywhere. And I walked in the house and I said, hey, babe, here's what I'm going to do. And I filed incorporation paperwork in January. So, within 60 days, I'd done it. I ordered a book online about direct primary care. I reached out to the direct primary care community because there was no DSC community, which is what you and I are partners in crime in, trying to create that. And I was ready to go. That's how that happened.
Thank you so much for sharing your story. It's very powerful for many people that feel stuck at this point. Now, because we talk about direct care and educating physicians, we also need to educate patients. And, most of the physicians that call me and probably call you will ask, how do you explain to patients that you don't take insurance? What's your spiel?
Sure. So this spiel gets better as time goes by, and I'm still getting better at it as well. But my current version is patients call, or they run into you, in my case at the grocery store or whatever, and they say, how can I come see you? I don't think you take my insurance, or do you take my insurance? Those are usually the two immediate questions, because our United States healthcare system is just addicted to insurance. We don't even think about, will you see me as a doctor is not the first question. The first question is, do you take my insurance? As if that's the relative piece of information. So here's how I answer that. Actually, I take care of people no matter what insurance they have, because I don't sign contracts with the insurance company. I only deal directly with patients. So that's the short 30-second blurb that I try to get people immediately away from that idea of, do you take my insurance? And then I go into what that looks like. So I say, actually, I take care of people no matter what insurance they have, or even if they don't have insurance, because I don't contract with the insurance company. I only deal directly with patients, because I don't care to be a part of the insurance, which is basically a legalized scam, in my opinion. And they take your money and they short me money, and neither one of us are any better off for it. So what I figured out is a way that I can take care of you directly, as long as you and I are a good match. And then I explain membership. So I still focus mostly on membership, which is going to be different than some of the specialty direct care practices that are up and coming. But that's because I started from a direct primary care background because of the story I told earlier. So I explained to them that in order for me to be able to take care of everybody, I've come up with this really fair, affordable way where for $60 to $100 a month, you're my patient and there's no hidden costs. And then if I get past that point and I'm, going into detail, the way I explain membership is that that covers all of the doctoring that occurs between me and you. There's no additional charges for appointments, or if you call me to ask me a question, or if I give you advice. The only things that you'll ever pay extra for is if it's something that I pay for on your behalf and I'm reimbursing the practice. For example, I have negotiated these nice low cash rates for labs that are like $2 to $5. So if you choose to get your lab work done through my clinic, I pay for it because that's how I get the low prices, but then I will turn around and I'll invoice you. So that following month, you'll see your membership price. And then you'll also see, $15. And that's from the labs that we did. Or if I do a test, that costs money for the clinic, like a biopsy, something like that. But you can use your insurance however you want because everybody's situation is different. So if you need blood work or an x-ray or something like that, what I can do is tell you how much the cash price is that I've negotiated. And then if you want to use your insurance to pay for it instead, you're more than welcome to, because I'm a doctor like any other doctor, and I'm happy to send the orders for you to get that done. Or if you want a medication, I can tell you how much it costs for me to buy it through the clinic. But if you want me to send it to a pharmacy, there's no problem. I'm a licensed doctor. I send it like anybody else, and you can choose, how you process that. The difference is just that I can provide you with a cash price so that you know what to compare to. And then you can choose how you want to do it. I don't make any money or, profit. I'm not set up to make money off that. That's just something I offer for my patients so that people have an option.
As a benefit of their membership. Now, we all have powerful stories with patients. Do you have one of those? Do you have a story of one of your patients that you can share with them?
I have so many, I'm so fortunate. I'm blessed. I guess we try to choose one. Well, okay. These are internal medicine patients, but we're doctors, right? So the title doesn't matter. Two of the biggest differences, practical differences I've been able to make for a patient. One was a young single mom who had recently lost her job and had no insurance and is a severe asthmatic. And this was going into spring of 2020 when everything was shutting down for COVID. And she had been in and out of jobs, her insurance always tied to the job. So she'd been uninsured and insured off and on. And had been on average admitted to the hospital probably 2 to 3 times a year with a severe asthmatic attack. She'd been intubated before. She unfortunately has several $100,000 of medical debt because of this. And she called me wondering if there was some way that my model could help her. I enrolled her. I delivered a $18 brand new nebulizer with DuoNeb packets to her porch. Because granted, this was in March 2020 when we were had no idea how COVID even necessarily was transmitted. I was able to get her sample inhalers and patient assistance inhalers, a peak flow meter for about $5 because I bought it for cash, and some prednisone tabs for emergencies. I filled out an action plan with her, and over the phone, we came up with the, yellow, green, red zones. She's been my patient for 3 years now. She has not been to the ER a single time for her asthma. She's not been admitted to the hospital a single time for her asthma. She is employed again. She has insurance again. Mostly has chosen not to use it because none of the cash prices have been higher than what her copays and things are. And when I admitted her to the practice in March of 2020, I did so on quote unquote scholarship. I did not charge her at the time. She simply paid when she could. And she paid every dime every couple of months whenever she got money. And she now pays a normal membership and is proud to do it because she's employed again with insurance. That's a huge life-changing event. And it's been very easy for me to take care of her.
And you as a physician, you can do your job, you can do your mission,
so
and you can
easy.
offer the help when you need without
Yes.
anybody interfering in that
Yes.
kind of relationship that we build with our patients.
Yes.
And
I mean, her and I high-fived when she got her most recent job. I was one of the first people she told. She was so excited.
Of course, you become part of their family, you become part of their, their life, and you really change their life, and you really give them an opportunity to come back to a normal life. This is extremely powerful for physicians to understand that in direct care, they can offer help to whoever they want and how
Yes.
they want it. They can tailor to the needs of the patient. Now, I know there are challenges in every practice, and recently we had 2 other talks, and I want to thank you for taking the time to invest in educating other physicians. In the other lectures, we talk about how to set up prices, and I will invite everybody to watch that talk. And we also discuss about how to market your practice in direct care. Again, a very frequent question that we have. And I would encourage everybody to watch that lecture also, because it's extremely valuable to see different points of views from different practices and to learn from that. And I would like you to share with others what will be the advice that you give to someone that is now considering to go into direct care or just started the direct care. What is your advice for them?
So I think the very first step still to this day is to reach out and speak to someone who's already doing it. That is getting easier, thankfully, to us trying to build some of these collegiate networks so that you can find each other. That was the biggest challenge when I started. As I said, it was 2018. The world kind of went out from underneath me professionally, and I had no idea that direct care even existed. I went through some pretty tough evenings and upset times trying to figure out what I was going to do with my career without this employer. And I probably still would have had that initial reaction, but it would have been much less painful had I known that I had an option. And that's why I think I'm so passionate about getting the word out there. And when you talk to other direct care doctors, primary care or the direct specialty care, which we're trying to grow, I think you'll hear like everybody wants to help other people because we've all been there. We all know why people went out. We all had times where we felt like we couldn't get out. And this has been like a light for us to be able to, light at the end of the tunnel or a path to freedom. And so I think we're all anxious to share that. And because of that, as we make it easier to find each other, that's the first move I think anybody should make. Just reach out. If there's a practice within driving distance, drive over there and talk to that person. I think you're going to find everybody's more than happy to talk to you. I don't believe, and maybe this is our next project, like we need more to do. I don't believe there's a direct specialty care book out there just yet. Add it to our to-do list. But there are several direct primary care books out there. And it's not 100% translated into what specialty care is going to look like, but it's a start. So I bought Doug Farrago's book off of Amazon. It's the DPC guidebook. It's probably the first book that anybody in DPC wrote. It's short, it's an easy read, it's passionate, which he is if you ever get a chance to talk to him. He curses, it's down to earth.
We have all these books linked and the links on our website, dscalliance.org. So if people are looking, I will post them in the comments of these videos, but they can go on our website and they can find all these resources there.
Yeah. So I immediately, after I found out about this, I went and visited the 3 practices that I Googled within like 2 hours drives of myself. Everybody was super welcoming, invited me in like I was their best friend, even though we were strangers. I read Doug Farrago's book in like a day, and I still have it somewhere. It's underlined. There's writing in the margins. I mean, I was on fire. And then once you've done that, get involved. I mean, this is why we founded DSC Alliance. It wasn't because we had a lot of extra time on our hands or a bunch of extra money that we needed to spend, to build websites. It was because we'd already suffered through trying to figure this out for ourselves. And I'll be the first to admit, I have not figured it out. I mean, it's a process. You're just along for the ride. But I'm farther along than people that are just starting. So we're just trying to build that ladder. We're reaching back and pulling people up. And some of those people are going to go right past me. I mean, honestly, and that's amazing. Like, because I hope they reach back and pull me up next. That's fine. But there wasn't anything like that. That's what we're trying to build. That's what we're trying to build, those links on the dscalliance.org website. But just jump in and let your colleagues help you. I mean, that is one of the neatest parts about being a practicing physician is you become part of a brotherhood, a sisterhood. We've all been through the same things. We've all suffered through med school, residency, fellowship in this case. so we basically grew up in the same like the same medical family. We all have that in common. And that's something that has been lost slightly. Well, too much with these employed physicians. It's like people are part of HCA or part of St. Alphonsus instead of being part of physicians. But that is alive and well in the direct care community. We call each other, we curbside each other. Everybody's very free with their time, giving out their knowledge, their cell phones. Take advantage of that. Come back to what doctoring used to be like. That's a big part of what I missed about doctoring that changed over the last, decade or so. We're here for you. Like, come find us.
We have to say that when you start in direct care, you can feel alone because you're not part of a big system. Mm-hmm. But creating the map and creating the resources for this community of physicians that are interested in direct care, it's going to be so much easier because you're going to know where to find your colleagues. You're going to know where to find the information for a phone call, to give a phone call to one of the cardiologists or nephrologists. Yes. Or because we started to have people from all specialties, and this is absolutely refreshing for us, because when we talked the first time, I knew you and you knew me, and we were doing direct care, you in your specialty, I was doing rheumatology. I had no idea about any other specialist in the country. And here we are, almost 3 years later, with, I believe we are hundreds now.
Yes. Yes, I'd say we're probably approaching thousands. Probably. We're right on that brink. And I'm sure you relate to this too. I mean, it's almost every day I get contacted by somebody. This is a need in the physician community. Doctors need an option to continue to practice medicine with integrity and autonomy and not feel like we're only giving ourselves to these employers, but we're actually, giving freely of ourselves to our patients, which is who we're passionate about helping. And patients need doctor. I mean, the need is so strong. And it's almost, like when you and I first started talking, like you said, almost 3 years ago to now, we've both felt like you can almost like feel the tide coming in. It's like the sand is shifting under our feet in a good way, because I've already felt the tide going out during my career. And I think we all have. It's like we felt the sand shifting. We knew it was bad, but we didn't know what was going to happen or how to, what we could do about it. This is what we can do about it. I tell patients this all the time. I don't know if this is the perfect answer or the long-term right answer. It's the best answer I've found so far.
Yes, it's an alternative. It's an alternative to what they have or what they are conditioned to believe that they.
I know what we've been doing in this country, doctor-wise, for the last 10 years with increasing employment, decrease in autonomy, and more profiteering is not the answer. I 100% feel that was not the answer. I 100% feel this is the best answer I've found so far.
Correct. Lara, thank you so much. I know your time is valuable, and I really, really appreciate having you here to share your story and to encourage other physicians to be in direct care. I hope to have more interviews with you to learn more about how your practice is going. And once again, thank you.
Thank you. My pleasure.